Ready to wear what may be your favorite color, red clothing, because tomorrow is National Wear Red Day. And here to tell us all about this day and why it's bigger than just a fashion statement is Dr. Joel Foreman. He's a cardiologist from the Christ Hospital Health Network. Good afternoon, Dr.
Good afternoon.
Nice
Thanks for having me.
So this was sort of an initiative that started 14 years ago with the American Heart Association. 500 million women at that time were dying or having heart disease. How far have we come since then?
Well, we've come a long way, partly due to awareness, and we've started to see declines in adverse events from heart disease in women. Previously, that was lagging behind men. A big part of that is this program of awareness.
And so what are some of the biggest contributors to heart disease in women?
Well, it's similar contributors as to men. The awareness tends to be less, and for many years we thought this was a man's disease. It is not. You're more likely as a woman to die of cardiovascular disease than anything else, than all forms of cancer combined. And just like in men, it's contributed to by an unhealthy lifestyle, diabetes, smoking, blood pressure problems, and cholesterol issues.
And so you see a lot of patients, I'm sure, that may have fall into some of those categories. What are some of the early risks? What can people, what signs may you exhibit at an earlier age, a younger age, where you may be at risk later on?
The first things is to control your risk factors. So to eat a healthy diet, to move your body in a dedicated sense, and to do dedicated exercise, 150 minutes a week. Control the risk factors. Don't smoke. Control your blood pressure. Control your cholesterol. Control your blood sugar. Know your numbers, so to speak. In terms of symptoms, women may have the same symptoms as men. Chest pain, palpitations, breathing problems. Sometimes, though, they tend to have a little less typical symptoms, as we say. They'll have fatigue, nausea, symptoms like that as a manifestation of cardiovascular disease.
I was going to say, I had read that that's one of the reasons why so many women have died from this, because they don't have the same symptoms that you see in men, for example, necessarily.
Absolutely.
And so what do you do to talk to your patients about them? I mean, obviously, it's important to spread the word about this and have awareness, but people who say, well, I like eating fried foods and I don't want to walk every day. Little steps. What can you tell someone if you can give them one or two things that they can do right now?
Well, simply paying attention is a big part of the battle, and you don't have to be perfect. Just like bad habits develop over time, good habits develop over time. So paying attention to moving more, to seeing food as fuel, and to try to move back towards more basic forms of nutrition, fruits and vegetables and lean sources of protein, goes a real long way to preventing problems. And then go see your doctor.
Regularly.
Know your numbers.
Yep.
And don't ever smoke.
Exactly. All right, well, thank you so much, Dr. Foreman, for joining us today. It was a pleasure.
Thank you for having me.